and welcome to Carolina Women. It's going to be a fun show today. We have Dr. Jen here, we have Dr. Allie here, and we are talking about physical therapy. And we're talking about physical therapy for women, I think at any age is really
any age.
Talk to us a little bit. Jen, I'm going to ask you first. That's Jen. I'm going to ask Allie first if I can. A little bit about your specific business in physical therapy, because you both come at this kind of from an interesting point of view. Yeah, it's a niche
so
market.
we both, we're bridging the gap between orthopedics and pelvic floor, actually. So we both have 15 years of experience in orthopedics. We both had our children and started having issues ourselves with some pelvic floor dysfunction. Decided to pursue a specialty in women's health and pelvic floor. A lot of women don't even know what that is or what to do or how to help themselves.
That's what I was just going to say. Take us from the beginning.
Yeah, so we treat patients anywhere from incontinence, leaks, severe period pain, constipation, painful intercourse, pelvic, hip, low back pain, I mean, you name it. The pelvic floor, just to really summarize quick, is just honestly a group of muscles that help to support our organs, our system, our sexual function, bowel and bladder function, and if these muscles aren't functioning right, they can cause severe problems.
And just like any other physical therapy, it's not anything that's overly complex. It's just taking your full assessment of the entire body and how that system's going to work. I think a lot of people are just intimidated by it being the down there area.
Exactly.
And so they think it's taboo or they don't really want to talk about it. There's embarrassment associated with it when there really shouldn't be, because these are functions that we have to use.
Yeah,
or
hell
like
no,
to use
I'm not
every
embarrassed
day.
to talk about it. I got about 500 questions.
Like, speak for yourself.
Yeah, exactly. Yeah, speak for yourself. But when do people need to come to you? At what point in time? What might people be experiencing at different ages?
Oh gosh, I mean, if somebody has not had a child yet, or they're family planning, but having difficulty, say painful intercourse, that would be a time, or even painful menstruation if they're still having their cycle.
Endometriosis.
Okay.
Lots of different things.
And then we do see a lot of pregnant and postpartum women. That is another specialty that we work with postpartum women. We work with them actually during their pregnancy to help them have a healthy pregnancy and help with their aches and pains.
I love this.
And then we help them postpartum. There is a significant lack in our healthcare system for postpartum women.
Yes.
You go to your 6-week checkup and they say, hey, you're good.
And they
And
send you home.
so you go after your exercise and you pee your pants, or you're afraid to have sex with your husband, or what. There's so many things. I know myself, I was like 6 weeks, I'm like, I am not ready for all of this, you know?
Right.
And so we want to bridge that gap. And we want to make patients feel like, oh, I can have a normal life again, I can do all this. And we want to be that support, that safe place where we can help the women in our community. Yeah.
Are there good treatment options out there for the treatment of pelvic floor disorders now?
Absolutely.
Are there a combination of lifestyle changes, medical changes, exercise? How do you all describe some of those?
With holistic and conservative. So what we do is we really
I
look
love
at
this, holistic and conservative.
Yes, holistic and conservative. We want to try to minimize the need for any other surgical intervention or the need to purchase things that work on the symptoms but don't help the underlying problem, treat the cause. So we look at the individual from top down in a whole body fashion. And so yes, there are lifestyle changes, body mechanic changes, posture control.
Exactly.
Breathing.
Interesting.
Fixing your breathing, learning to relax, meditate, strengthening. We are all for the core, pelvic floor, glutes,
hips, you name it.
Yes.
But diet even, I mean, a huge aspect when it comes to, say, leaks, bladder, bowel issues is what
Diet
you're consuming.
Lemonade, bad thing.
probably a bad thing.
Probably a bad thing.
Yeah. Women don't get enough fiber.
It just makes you tinkle all the time.
There are foods like like a lot of caffeine and things like that that are considered irritants. But we take a whole, like Jen said, a whole body approach. But we really are advocates for movement.
Yes.
So getting you to move properly, good body mechanics, strengthening, getting good mobility, working on weak muscles, tight muscles.
So how does one know if they have a disorder?
Oh, that's a great question. So if you're having pain, where you should not have abdominal, pelvic, hip, low back pain. That's your body's way of saying something's going on.
That's not normal.
Makes
If
sense.
you leak when you cough or sneeze or exercise.
Right.
If
We call that a tear running down our legs.
And I remember my mom saying, "Oh, it's normal now. You've had a baby." I'm like, "Mom, did you know that's not normal?"
And that's the thing, because I think so many of us, whether you've had a baby or not, you get these things and you call your mom. Like, that's who you go to. Because sometimes you don't want to bring it up to your doctor because it seems like such a small thing. And so, Mom, this is happening. Oh yeah, honey, that's fine. Because their mom told them that was fine. And they don't realize now that there are all these interventions and all these treatments that are available.
And effective.
And
Yes, very
Very
effective.
effective.
So let's just make this clear.
Yeah. Okay.
You coming for 5 minutes is so not enough time.
I know. We just
will you,
started.
Yeah, will you all come back and really, I think it's really interesting, and I guarantee you we'll be getting a lot of positive feedback from this. Thank you so
Absolutely.
much for joining us.
Thank you for having us.
And they do it all with
you.
a smile, too.
I know, there's a lot more to
Because we
come
love it.
here on Our Carolina Women.